You can see my fingers feeling for the mandibular angle so I can figure out where the bone is, because it's not as easy as you might think to know where to put the needle. You don't just put it in anywhere and hope for the best. You have to ensure that you're safe as well as getting the correct result. What she wanted in this case was more jawline definition in this region, so I used filler to try and increase the jaw width here slightly. But the problem with going too far when you do that is the jaw becomes too wide and a woman can look too masculine. So for female patients, I always have that conversation before we begin, and they're happy for me to stop when I think there's enough filler in there. For male patients, I can inject a lot more because it adds to the masculine look if you go wider. Once I've found the mandibular angle and I'm confident I have the bone in my left hand, I'm slowly placing the needle onto periosteum with my right hand. Before we started, we never put any numbing cream or anesthetic because the injecting doesn't hurt at all. This patient was even having a conversation with me as I was working because it was so comfortable. And I'm only placing around 0.3 mil each time I inject because I don't want a big ball of filler somewhere. I want the entire region to be smooth and blended in an L shape while still making a wider jaw. So with that in mind, this is why I'm injecting in multiple places, quite close to each other to try and support the skin in the whole region and not just one single point. And the filler I'm using is called Reveness Shape. It's absolutely one of the best fillers I've ever used and I highly recommend it. Check the link in the top right corner if you want to see why I made a video on it. To stop a horror story from happening, you have to inject outside of blood vessels. You have to know your anatomy. The important vessel here is the facial artery. It crosses the mandible, usually a few inches in front of where I'm injecting, but it's still something I try to physically feel before I start injecting so I can absolutely make sure I avoid it. So before each injection, not only am I trying to plan where to create the definition by where to put the needle, but I'm also trying to work out how to avoid the arteries. And this is the final result, and as you can see, there's great definition all along that jawline. It will last probably about a year, and then she'll need maybe a tiny bit more, but then that's probably going to be it for another couple of years in my opinion, because fillers can last a very, very long time. For aftercare, I told her not to massage it because we don't want to lose that definition by spreading the filler away from where it's been placed. And I also advised not sleeping on her side for that night for the same reason. I did the chin too to complete the side profile. And if you want to see that being injected as well, I'll leave a link in the corner here when that video is uploaded.